Welcome, everyone. We're so happy to have you here on this lovely Thursday. Um, this is Don't Sugarcoat It, a webinar from Ochsner Digital Medicine. And today with me is my friend Marilyn. She is a senior clinical pharmacist on the team, and she's going to be hosting our presentation today. Everyone will get a recording of this in our thank you email. So if you missed something, no worries. And keep in mind that the question and answer chat box is open. So if you have any questions at any point, ask away. We'll stop and answer them. But Marilyn, if you want to take it away, I'll be watching.
Thank you, Ashlyn, for the lovely introduction. So today we're going to go over what type 2 diabetes is, how it's diagnosed, and what complications can come from type 2 diabetes if it's not well managed. We'll also go over the basics of how type 2 diabetes is treated and what Ochsner Health Digital Medicine offers to help people living with diabetes. So diabetes is a chronic disease that affects too many people. 37 million people in the United States, which is roughly 11% of our adult population, has diabetes. About a quarter of that group have not even been diagnosed yet. Pre-diabetes is the precursor to full-blown diabetes, and this affects about 38% of the adult US population. In people age 65 years and older, this affects nearly half of the population. All this to say, diabetes is far too common, which is why it's important to really understand it so that we can better manage or even prevent it. Now, there are several types of diabetes that I want to kind of briefly review to set the stage for today. Type 1 diabetes is an autoimmune condition, which means that the immune system, in this case, attacks the pancreas, which is responsible for making insulin in our body. This will typically then lead to the pancreas making little to no insulin. And you may know of type 1 diabetes often being referred to as child onset diabetes, since it is most often diagnosed in childhood. Type 2 diabetes is where the pancreas simply makes less insulin than it used to, and the body then becomes less responsive to insulin. This means that your body stops being able to use that insulin. Sometimes type 2 diabetes is referred to as adult onset diabetes. Now, for the rest of today's presentation, we'll be focusing on type 2 diabetes only. So just keep that in mind. I do want to kind of go over briefly. There are also other less common types of diabetes, such as gestational and neonatal diabetes, but we won't be going into much detail about those today. So let's take a look at what happens in our body when we have type 2 diabetes. We'll start by eating something with starch or sugar in it. Let's say a piece of king cake. Now that king cake then enters the stomach and the carbohydrate is then broken down into glucose here in step 3, a simpler sugar. Glucose then enters the bloodstream and the pancreas then either does or doesn't release insulin. Or in the case of type 2 diabetes, the body is resistant to the insulin needed to help convert that glucose into energy. This then causes the glucose to build up in the blood. And that results in the body trying different ways to get rid of that extra glucose, such as eliminating it through the urine. This can lead to symptoms of diabetes, such as feeling tired, thirsty, and frequent urination. So how does one find out if they even have type 2 diabetes? Diabetes is usually diagnosed with a finger stick or a lab draw. The finger stick will produce a drop of blood to tell us what your plasma or blood glucose is. This can be drawn at any given time or on an empty stomach. If it is drawn on an empty stomach, the reading should ideally be between 80 and 130 milligrams per deciliter to be considered normal. On the other hand, the lab draw is where a small vial of blood is drawn by a phlebotomist. This then allows us to determine your hemoglobin A1C, which is a measure of your average blood sugar levels over the past 3 months. It's also the main test that your care team will use to manage your diabetes. It's really important to note here that the higher your A1C, the greater the risk of diabetes complications. So, really reaching and maintaining your individual A1C goal is very important if you have diabetes so that we can prevent those complications. So, what complications might be associated with diabetes? This slide lists just some of the complications of type 2 diabetes. So the first being increased emergency department visits and hospitalizations. With diabetes, it's sort of a balancing act. So if you have readings that are really high or really, really low, that can sometimes necessitate a visit to the emergency room. People with diabetes are also twice as likely to have heart disease or stroke compared to people without diabetes. And so sometimes that can account for hospitalization as well. Um, Diabetes is one of the most common causes of end stage kidney diseases. So, a lot of times, people with type 2 diabetes also end up having chronic kidney disease. Diabetes is also the leading cause of blindness among adults aged 18 to 64 years. And then, even more serious, diabetes is the seventh leading cause of death in the United States. In addition to these health concerns and complications, there are also some hefty costs associated with type 2 diabetes. In 2017 alone, $237 billion in medical costs related to type 2 diabetes were spent. And then harder to kind of quantify, but indirect costs. So having diabetes and having to go to the emergency room or having to go see a doctor about your vision loss can lead to lost productivity from work, unemployment from disability, and then premature death. So very serious, and most of these complications are preventable with consistent monitoring and management, which includes a mix of diet, exercise, and medication. Now, some people are at greater risk for developing complications from type 2 diabetes. Smoking or other tobacco use can increase risk of complications. One thing to note is that almost 90% of US adults with diabetes were also found to be overweight or obese, which is defined by a body mass index or BMI of 25 kilogram per meter square or higher. Being physically inactive or sedentary is also a risk factor for complications. So you might ask here, how much is too little inactivity? Physically inactive here is defined as getting less than 10 minutes a week of moderate or vigorous activity in the categories of work, leisure time, and transportation. So really almost no activity. And as I mentioned earlier, the higher the A1C, the greater the risk of developing complications. So generally, we really want to make sure that the A1C is at least less than 7%. High blood pressure is also a risk factor. For most adults, the goal is to keep blood pressure less than or equal to 130/80. And then high cholesterol is another risk factor. In fact, the trio of diabetes, high blood pressure, and high cholesterol can significantly increase a person's risk of developing heart disease, which again includes heart attack and stroke. So these are not minor issues. They very much can have a significant impact on one's overall health and quality of life. So I mentioned earlier that regular monitoring is a key part of good diabetes management. This means seeing your doctor or care team regularly so that your A1C can be monitored to see where you are compared to where you need to be. For many people with diabetes, the general goal is to get your A1C to be below 7%, though we still would want to get you as close to normal range as possible to really limit your risk of complications. Since lab draws are only done at most every 3 months, they don't really allow you to have a good day to day understanding of how you're doing. And so This is where self-monitored blood glucose readings come in, or SMBG. People with diabetes can monitor their own, oops, sorry about that, can monitor their own blood sugars at home with the use of glucometers. This involves pricking the finger with the lancet and placing a drop of blood onto a little test strip. That test strip is then inserted into the glucometer to read the blood or plasma glucose level. This can be checked on while fasting or on an empty stomach. It can also be checked 1 to 2 hours after a meal and also at bedtime. And the ideal normal ranges for those times that the blood sugar is checked is listed here on this slide. Um, if your reading, for example, taken 1 to 2 hours after having lunch was 220, that would be considered above goal or out of range. This is just a visual sample of what different glucometers can look like. A lot of glucometers can now sync to your smartphone via Bluetooth, so you can have all that data in the palm of your hand to share with your doctor or care team. There are also CGMs, or continuous glucose monitoring systems, that can check your blood sugars around the clock. Now, I have to say, not everyone is a good candidate for this, but it can be really helpful for people who are taking insulin and maybe have a hard time getting their blood sugars well controlled. So now that you have an understanding of what type 2 diabetes is, let's talk about how we manage it. And one of the key ways to manage high blood sugars in those with type 2 diabetes is via prescription medication. So there are a wide variety of medications used to treat diabetes. As a clinical pharmacist, it's my job to really know the pros and cons of all these options so that I can work with my patients to select the best options for them. On this slide are listed a few examples of medications that we use to treat diabetes. In general, they can be oral medications or injectable medications. Within the injectable category, there's insulin therapy, which helps to replace the insulin that our body has stopped making. And there are also non-insulin therapies, which have different mechanisms of action that I won't go into today. Keep in mind, this list here of diabetes medications is not exhaustive. Within each, class of medications, there's many different medications. Most of these classes all have different ways of working to help lower blood sugar. What is important here is that every medication has its own set of benefits and risks. What might be the best option for you might not be a good option for the next person. So it's really important that you work with your provider or clinician to figure out what options are the best fit for you and your A1C goals. So what else is helpful for managing diabetes? Since diabetes is a condition where the body is struggling to deal with excess glucose, it would make a lot of sense that what and how we eat has a huge impact on how much extra glucose our body will have to deal with. So let's talk about diet. One of the most common things I hear from my patients with diabetes is, oh, but my A1C was taken right after the holidays, especially when that A1C is above 7%. Well, yes, it's true that the holidays are a time where many people change their eating habits. The weather is cooler, the food gets richer, we're having a little bit more regularly, especially as those celebrations take place. What I'd like for you to maybe think about is that there are always reasons to not eat with your health in mind. In fact, if you break down a typical calendar year, you'll see that there are reasons all year round to let go of our diet. You can start the year off with Mardi Gras season, then segue into crawfish and seafood boil season. Then we drift into the warmer months and we're having more barbecue. It's festival season and ice cream is out. And then, it's Halloween. We have sweet treats galore, and we're right back into holiday season. The key here with diet is year round daily moderation. If we can be mindful about what and how we're eating, on a day-to-day basis, we can make better choices that allow us to remain in control of our health, and still get that enjoyment of, having some seasonal and cultural foods, because really that matters too. Now, a lot of these so-called seasons also might involve drinking alcohol, and alcohol consumption is something that can impact blood sugar control as well. The safest approach to drinking alcohol if you have type 2 diabetes is to drink in moderation, choose beverages that are low in sugar and carbs, and to never drink on an empty stomach. No more than one drink a day for women and up to two per day for men is the general guidance. And so you might be wondering, what should I be eating, if I'm prioritizing my health during all these seasons? So it's really important to prioritize complex carbohydrates and whole grains, such as whole grain bread and pasta, or brown rice and brown pasta, oats, lean proteins such as chicken, turkey, fish. For my vegetarians out there, tofu, beans, eggs, and plain yogurt are all sources of good lean protein. And then getting fiber from fresh, non-starchy veggies. These can be frozen too. So things like broccoli, Brussels sprouts, green beans, berries. Healthy fats are also going to be important. You can get those from things like nuts, avocados, plant and seed oils like olive and avocado oils, and then oily fish for those good omega-3 fatty acids as well. And then keeping drinks simple. So best bet is water. That's 0 calories, zero sugar. You can also opt for something bubbly like unsweetened carbonated water, and unsweetened teas and coffee are an option as well. Eating healthy for diabetes also means limiting or cutting down on things like refined carbohydrates, such as white bread, white rice or pasta, starchy vegetables, especially potatoes. Those can be really high in carbohydrates. And then you'll see the word processed on this slide a lot. So processed foods, so things that come in a bag, a box, or any sort of plastic or paper packaging. If it's coming in a package, more likely than not, it is processed and will have more sodium and sugar and carbs in it, and even preservatives than you would get from eating something that was fresh. Foods that are high in salt, so chips, again, packaged for processed foods. Limiting butter and red meat, limiting foods with added sugars like cookies and sweetened desserts, and then sweetened drinks as well. So sodas are very high in sugar and can definitely cause blood sugar to spike up. If you take away nothing from today's chat about diet, I or in the right diabetes diet for you. And that's going to look different from person A to person B. So really important to individualize your plan. There's no one size fits all approach when it comes to figuring out what a diabetes diet can look like. People can work with a registered dietitian to figure out the best serving sizes of carbohydrates, proteins, and fats that they need. And then incorporate choice. People need choice and variety. You should be able to follow a pattern of eating that works well for you, whether you're vegan, vegetarian, or something else. And then it's really important too to set realistic goals. Restrictive diets that don't fit in with your culture or your lifestyle are most likely not going to work in the long term. So, in order to make lasting changes, set realistic goals. If you want a simpler way to think about what your meal should look like, this is a nice picture. I have a patient who's going on a cruise next month. So we went over this yesterday just to kind of make sure he wasn't going to stray too far from his diet when he was on a cruise buffet and picking out what to eat. So the general rule of thumb here is if you're making yourself a plate, and this is an 8 to 9 inch plate, not a honkin', 11 to 12 inch plate. Keep in mind that you want to aim for that that plate, half of that plate should be non-starchy veggies, because remember, again, starchy veggies tend to be high in carbohydrates. And then a quarter of that plate should be some form of protein. Again, ideally lean proteins like chicken, turkey, fish, tofu, beans. And then the other quarter of that plate should be some form of whole grains. So brown rice, brown pasta, quinoa, things like that. Now let's switch gears and talk about movement. So being active, how does exercise, how does movement even help in diabetes? Actually, being active makes your body more sensitive to insulin, which then helps control your blood sugar levels. Exercise also helps to lower your risk of heart disease and nerve damage. And I kind of skipped over it earlier, but chronic nerve damage that can happen with type 2 diabetes can lead to the risk of having to deal with lower limb amputation. So that's one of the things that we want to prevent. Other benefits include maintaining a healthy weight. So exercising can help us do that. Feeling happier because exercises releases happy hormones, better sleep, better blood pressure, and better blood cholesterol. The general recommendation with exercise is that we should all aim for at least 2.5 hours per week, or 150 minutes per week of moderate intensity physical activity. So looking at that a different way is if you get in 20 to 25 minutes of activity every day each week, you can easily meet this goal. So what is considered, moderate intensity activity? This includes walking briskly, walking like you have some place to be, doing housework, so scrubbing dishes, vacuuming, that can definitely help break a sweat, mowing the lawn, dancing, playing sports. These activities can all activate your large muscle groups, increase your heart rate, and make you breathe harder, which is all considered important goals for fitness. And in addition, these moderate intensity activities are really paired well with stretching. So we recommend doing that too before and after your activities to help make sure you're flexible and to help prevent soreness and injury. We don't want anybody getting hurt. And when it comes to exercise, if you don't take anything away from today, I hope it is kind of the general guidance on this slide. Really, I think it's important to find something that you enjoy doing. If you don't like it, it's a lot harder to stick with it and make it a habit. And then second, it's find a partner. It's more fun when someone else is counting on you to show up. It's a way to build accountability. I mean, it's harder to skip your post dinner walk if the rest of your family is waiting on you to join them. And it can also be a great way to bond with someone that you care about. Third is start small. If you're not already physically active, begin slowly and work your way up. We really want to avoid injury and build a habit. So maybe start by parking further from the entrances when you're going to work or getting your groceries. Maybe take the stairs instead of the elevator. Do yard work instead of outsourcing that. Walking the dog, I'm sure the dog would appreciate it as well. And then scheduling it too can help make it more of a habit, because the more regular you do an activity, the quicker it can become a habit. So to sum up some of the key points from today, type 2 diabetes is a condition where the pancreas makes less insulin and the body becomes less responsive to insulin, which then results in excess glucose in the body. Serious complications of untreated or uncontrolled diabetes include chronic kidney disease, loss of vision, heart disease, nerve damage, and lower limb amputation. Treating type 2 diabetes is a multi-layer approach that typically involves regular blood sugar monitoring, dietary changes, physical activity, and prescription medication. I hope you learned something that was of interest to you today. I'm going to now switch gears and kind of talk about what our Ochsner Digital Medicine program can offer in the way of diabetes management.
Before you get
So
started, we have
the Ochsner,
one
oh, go ahead.
question.
Yes.
Someone would like to know if type 2 diabetes can be reversed.
Yeah, so the word reversed, it can be managed and treated, I would say. Once you are diagnosed with type 2 diabetes, that is a diagnosis that stays in your health record. However, it can be managed to a really good level. So, let's say you started off with diabetes, your A1C was really high, you worked with your physician and your care team to get that A1C less than 7. And over time, with good diet, good exercise, maybe some medications, you get it down to even normal range and you stay there for some time. That is kind of what I picture when I think of diabetes being reversed, but that's also just well managed, well controlled type 2 diabetes.
All right, we're good to go.
Okay, thank you. So the digital medicine program here at Ochsner, it really does put the power in your hands. It's a proven program to help manage chronic conditions from home. Um, and to make it easy and convenient for you, we currently provide care for hypertension, type 2 diabetes, and high cholesterol. We use these really easy digital devices. We help with medication management. That's mostly what I do. Our health coaches are there to offer lifestyle support, and we have proven results to really help people get their chronic disease states well controlled. How does the program work? In this digital medicine program, you'll have a dedicated care team to help you manage chronic conditions. I'll speak more on what those care team members are in just a little bit. I kind of alluded to it earlier. You'll be able to monitor your conditions remotely from anywhere while at home or even while you're on vacation using your digital device. Um, and then the care team will help you get treatment, medication management, and also work with you to create healthier habits, such as working on diet and exercise. In total, really, the care that you get from this program is made up of lifestyle and health coaching, and then also medication management when that's appropriate. The care team is comprised of a clinician, which is either a clinical pharmacist like me or a physician's assistant, as well as a health coach and a support team for technical support or any sort of digital medicine needs. Um, the clinician's primary role is to review readings, so blood sugar and blood pressure readings, cholesterol results from lab draws, and then figure out if a medication adjustment is necessary. The clinician will also take into account your health history, prior treatment, and medication affordability to develop a personalized treatment plan for you. As far as health coaches go, they use the data and detailed personal and social history in your patient profile to provide education and support, and they work with you to implement lifestyle changes to help you reach your health goals. And then the support team, they are there to help patients with general questions, enrollment, provide technical support, or any other sort of digital medicine support needs as they come up that aren't covered by the clinician or health coach. And I mentioned earlier that we have proven outcomes. This is what I'm talking about. So almost 80% of our members achieve their goal blood pressure after working with us after 6 months. About 80% of members also achieve their A1C goal after working with us for 6 months. And then about 84% of members believe that we are committed to improving their health. We've also reduced ER visits and hospital admissions among both our blood pressure and type 2 diabetes programs, as seen here on the right side. And I think something that's harder to capture is just how our patients and members feel about the program. 4 out of 5 of our members with high blood pressure and or diabetes, like I said, control their conditions within 6 months of working with us. Miss Aisha here is one of our patients. She says she's sleeping better. She feels her hair, skin, and vision has improved. and has even provided a testimonial saying that she feels this program has saved her life. As a clinician, I mean, I think that's the ultimate sort of review that you can get from a patient. And it's just so beautiful how she has really benefited from this program. If you're ready to get started, you can pull your smartphone out and scan this QR code to log into the My Ochsner app and fill out a questionnaire. If you don't see a questionnaire, you can go to that website there, ochsner.org/go-DM, to kind of get your journey started with us in digital medicine. And now I'm going to hand it over to Ashlyn.
Great job. Along with that questionnaire, please scan this QR code and it'll bring you to a link tree with all of our social media. We're on Twitter, Instagram. I lost the PowerPoint. There we go. We're on Twitter, Instagram, Facebook, and LinkedIn. We post regularly. We have tips and tricks. We have lots of great information being shared. So please give us a follow. Our next webinar will be in August. So stay tuned for some registration information on that. It was such a joy to have Marilyn host this one. You did amazing. And we just want to thank everyone for joining and being involved with Ochsner Digital Medicine. Like I said, this was recorded and you will get a thank you email with the link. So if you know anyone that you would love to send this to or would benefit from our program, feel free to share it and be on the lookout. I hope everyone has a great rest of their week and a great weekend. Thank you again, Marilyn, and thank you everyone for joining.
Thanks for having me. Have a great day, everyone.
Bye-bye.